Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
What are the clinical features of Graves' disease? So, if you see the clinical features of Graves' disease, a patient with Graves' disease has hyperthyroidism symptoms. Number one, he has symptoms of hyperthyroidism. So, first, the hyperthyroid symptoms which can be seen in the Graves' disease are these. First, if you see the hyperthyroid symptoms, the patient will have heat intolerance. Increase the sweating and thirst can be seen, weight loss is seen, and the patient eats a lot. Even despite of eating a lot, despite of adequate calorie intake also, there is weight loss is seen in these patients. And because the Graves disease, there is adrenergic stimulation occurs in the Graves disease, so the patient also develops some symptoms like, because of the adrenergic stimulation, the patient develops palpitations, nervousness is seen with fatigue, emotional lability, and hyperkinesis, and tremors are also seen in these patients. Then, if you were asked what is the most common GI symptom in a patient with Graves disease, the most common gastrointestinal symptom is presence of increased frequency of the bowel movements, and diarrhea is seen in patients with Graves disease. Then in Graves disease, the patient also presents with some cardiovascular symptoms, like the patient will have other symptoms are also seen, like the patient will definitely have weight loss. There can be facial flushing, warm and moist skin is seen with tachycardia, cutaneous vasodilatation, and collapsing pulse are sometimes seen in patients or are seen on examination. So on examination, you can see that there is weight loss, facial flushing, warm and moist skin is seen with tachycardia and cutaneous manifestations and cutaneous vasodilatation. Now, if you see in females, Graves' disease can present with some menstrual issues. So in females, the patient can have amenorrhea may be seen due to Graves' disease, and the patient can have decreased fertility. Obviously, if there is amenorrhea, if there is no or less menstrual cycle, obviously the patient will have decreased fertility, and there is increased chances of miscarriage are also seen in females. Whereas if you see in children, because of this Graves disease, that is increased thyroid hormone, the children will have rapid growth, and because of this rapid growth, there can be early bone maturation is also seen in these children. Then if you see the elderly patients with Graves disease, in elderly patients with Graves disease, they most commonly develop the complications of cardiovascular system. They will develop cardiovascular system complications, like they can develop atrial fibrillations and congestive heart failure are seen in older patients with Graves disease. And in almost 6 to 19%, you will see that they are sorry in almost 6 to 19%, the patients are associated with overt cardiac failure can be seen in Graves disease. Then on examination, you can see that the patient will have facial flushing, weight loss, warm and moist skin, tachycardia, cutaneous vasodilatation, and collapsing pulse is also seen. And along with that, we will see that the patient will have bruit on thrill is also seen at the upper lobe. So if you auscultate, you can hear the bruit, and thrill can be heard mainly because of increased vascularity. Loud venous hum may also be seen in the supraclavicular space. In supraclavicular space, loud venous hum may be seen in supraclavicular space. And if you examine the eye If you examine the eye, then ophthalmopathy can occur or orbital proptosis. Ophthalmopathy or orbital proptosis may be seen in 50% of the cases, and there can be dermopathy can be seen in 1 to 2% of the patients might present with dermopathy. And why is this dermopathy present? This dermopathy is mainly because of the deposition of the glycosaminoglycans. These deposited glycosaminoglycans are responsible for thickening of the skin. They will cause thickening of the skin, especially in the pretibial area, and they also cause thickening of the skin in the dorsum of the foot. Now, because of the thickened skin in the pretibial and dorsum of the foot, the patient will have pretibial myxedema, which is an important feature of Graves' disease. In the Graves' disease, the patient can also have gynecomastia. This gynecomastia is actually more commonly seen in younger males when compared to the elderly. Then rarely there is also involvement of bones are seen, that is called as subperiosteal bone formation is seen, and thyroid acropathy is also seen. In subperiosteal bone formation is seen. And what is thyroid acropathy? This thyroid acropathy is nothing but swelling of metacarpals is seen, which is called as thyroid acropathy. So this thyroid acropathy and subperiosteal bone formation are also the rare findings in Graves disease.
Thank you and thank you for watching.